I would request Dr. Jagmeet, along with our moderators and all the panelists, to please take the stage, and Dr. Jagmeet to do the opening remarks. Thank you so much.
The 1,000 Days Collective, I would say a 360 degrees perspective to look at the most crucial window of opportunity to make a difference in India's future generation. That we are really not engaging with the nutrition science professionals of this country aggressively in this ecosystem. So what I wish to say is, today I am at the pinnacle of this fraternity. I am the leader of a premier institution which is training professionals, but we are somewhere missing the bus in terms of working on the nuances of nutrition communication, which has to start from the grassroots level, and it has to be layered by more senior, more mature, professionals to kind of map it and see that, the delivery trickles from top to bottom. Well, setting the context for this important session on making scale work, what enables partnering with government systems? Let me begin by making a submission that Indian government is committed to the national mandate of Suposhit Bharat 2047 and has already created a robust ecosystem to execute the story of first 1,000 days. Now, what I see in this panel is a very good blend of stakeholders, people who are from government, people who are from reputed national institute, Dr. Neelam Mohan, who is heading a very important vertical of pediatrics, trying to, quantify things which we are doing on field, and also doing capacity building for the people who are working on field. I would be looking forward from Dr. Neelam Mohan, her views where convergence can happen between the strengths of nutrition science professionals and pediatricians, and how can we scale it for the best outcomes for first 1,000 days.
Pleasure to be on this dais in the company of such illustrious people, to be very honest. To begin with, Dr. Khera. The good part about me and Dr. Khera is that we go a long, long way, and Dr. Khera has been a part of the government at the ministry in Delhi. So he wears two hats. Once upon a time, he was looking after the maternal and newborn child health for the government at the national level. And now, post his retirement, he's picked up a job and he's looking after Engender and leading that organization pretty well. The first thing that we would like to know from you, Dr. Khera, is would you be able, through your experience on both sides, be telling the audience that a program was implemented and the program really got adopted by the government and was taken to scale and really did not have to start a parallel program which the government was already implementing? So would you be able to throw some light on that, on any kind of experiences you had during all this professional life, sir?
We keep boasting that in India, we have 1 million ASHA workers, And to be very frank, if we really want to address the agenda of 1,000 day, I think you need 10 million ASHA workers. One ASHA workers catering to maybe 1,000 or 2,000 population, and the kind of the work she is doing, it is not only the counseling on nutrition, not only counseling on tuberculosis, or maybe when the COVID pandemic was there, there are so many, kind of the jobs which has been given to the ASHA worker. So one ASHA cannot deliver that kind of a work, So the solution is, I think we need to have more ASHAs. We need to support the system. And then the second, the point which to my mind, as a public health professional, because 1,000-day agenda, it's a fantastic agenda. This is a real public health approach to addressing a crucial challenge of, child survival, thrive, and the undernutrition for both mother and the child. But in a real practical sense, we need to have the agenda for, there should be a life cycle approach to the nutrition. I think you may not be aware the kind of the challenges the elderly population face in terms of undernutrition. But from a public health perspective, we have segmented that age group. That means the 1,000 day. It's a real public health approach. One can keep on expanding to adolescent. We can keep on expanding to the young girls and so on and so forth. So I think the 1,000 day approach is a fantastic approach as on today. Maybe tomorrow, I think, when we succeed, when we improve, we keep on adding, more elements to it, that's, one important thing. And then the second, the point which I really want to mention, particularly when we are talking about, 1,000 day agenda, there are challenges, there are issues, but I think we have to keep in the back of the mind that we have to follow the ecosystem approach. I think somebody made a reference because things like early marriages, education, sanitation, there are a number of so-called the socio-economic, socio-environmental variables which determine the health and nutrition outcome. It is not only nutrition which is really going to address the problem of the undernutrition. I think ecosystem approach, which used to be called as the sector-wide approach, it has to be a comprehensive approach. If we really focus on health and nutrition, to my mind, we will not be able to achieve our goals. And you're all aware that, 50% of the health outcomes, they are outside health and nutrition. So these are the two things which I just wanted to say. Thank you.
Oh, that's wonderful. I think what you picked up is first is your frontline workers' strength is sufficient, absolutely not sufficient enough to reach the goals of 1,000 days. The sector-wide approach, that's something we have to look at, a holistic way of looking at things, right? So these are the two takeaway points from what Dr. Khera has mentioned. But I'll move on to Dr. Subbarao.
Thank you very much. I'll just take from what Dr. Sachin initially said. When you're called as a moderator, you're not expected to be an expert. When you're called as a panelist, you're also not expected to be an expert. The National Institute of Nutrition, has it done anything that has changed the course of events at all or not? I don't say that it's the National Institute of Nutrition itself which has changed, but the very focus of the ICDS being a supplementary nutrition or feeding program to talking about woman, motherhood, then care, and first 1,000 days in itself is a change. So that's the evidence that has actually put together the entire focus shift from mere supplementation to the first 1,000 days. Nutrition and engaging family in preconception nutrition is one more thing that we want to look at now in future. Hopefully it will have some impact that can be talked about in subsequent deliberations on 1,000 days or 1,000 minus 1,000 days, that pre-1,000 days, as you said. But I say minus 1,000 and plus 1,000 is also very, very important.
Dr. Subbarao, what I take the message is that you're trying to concentrate now on minus 1,000 days, and probably the evidence that comes through and gets generated may inform the government and the people who are actually looking at 1,000 days, and maybe there could be a new architecture of program or the focus of program which not just encompasses the 1,000 days but also will be allowing them to think about period before that as well. So maybe there could be a paradigm shift in the policies of the way the programs work. But thank you for that.
Problem, I think, in India is we work in silos. We haven't really understood the meaning of partnership because we are pretty happy in what we are doing and we have a lens which makes us look only in that field. Throughout the country, we max 20,000 in our highest, otherwise average says 13,000 nutritionists. And if I'm lying, you can go and see wherever you are, feed nutrition and nutritionist, you won't find many. So can they address for the country? So the answer is big no. And then we are talking about without NIN, we would get basic guidelines like we were looking into B12 at 190s and they suddenly said it's time to look close to 300s, which looks very, so they give us evidence. So that is really nice. You need some evidence. But the problem is what? Problem is in execution. The marriage has to be at a very many levels, and I need to look what she knows and appreciate and magnify it. That should be mine. That means, so what did I do? First thing is, we met and spoke to each other 6-8 months back when you are a president-elect for a year. So what is your vision? I spoke to sir also that my vision is to bring about the nutrition andolan in India. How do I get that nutrition andolan in India? I have to say the same word which is said by her or him or him. That means unless I use the same word, anemia muk Bharat, portion. So people get connected with those words, and we have to use the same words. Like pediatricians were going, bye-bye anemia, go anemia. All, you should never use different words. The Andolan means you need to speak the same language, same thing by everyone. And that is the need of the day. Why in India that we could reduce in the last decade under 5 mortality, neonatal mortality, infant mortality. But what did we do in 1 decade in nutrition? Do you know? In under 5 nutrition, we actually worsened. Anemia was 55, 60, we are 67%. After Anemia Mukt Bharat 2018, now we are 67% under 5. 55% adolescent girls. More than 50% women. So we are actually, and stunting 35%. Minimum acceptable diet for a child between 6 months to 2 years, as a clinician, I should tell, is 11%. Is my country so poor that only 11 can understand? That means what is the problem? Knowledge problem. I don't know what to feed the child right, whether I'm rich or poor. So behavior change is what you need to bring about. Your next topic should be how to focus on a behavior change. And that behavior change, what is it needed? To 11% minimal acceptable diet means frequency and diversity.
So thank you so much. I think the audience would have realized why I said she's the strongest voice in the country right now. Dr. Jagmeet, I'm going to take the point from what Dr. Neelam said about partnerships and collaboration. And
Let me begin by saying that nutrition is a national mandate, and that's where we have to pitch our bid towards that mandate. That's the point which I was trying to drive here, and that's where all of us who want to do something in the field of nutrition should connect with the nutrition science professionals. Using their capacity, using their help, you evolve strategies starting from top to bottom. The job of a nutritionist is to reach the person, not the person reaching the nutritionist. So we have to make it context specific. And what I was talking in the point which I was making when I was answering or giving a comment was that we got an opportunity as an educational institution. And when we collaborate with government, when we collaborate with organizations, we can really scale up the execution. So today, when we worked with ICDS Commissioner Maharashtra, and we worked in the aspirational district of Gadchiroli, we could work with the grassroots level workers. We could understand that there is a complete disconnect between what we are giving them and how are they using them, and what is it that I can do the value addition at that level. So as a nutritionist, I could think of a strategy that the take-home ration, which is a fantastic vehicle, right? It is getting fortified. I'm seeing to it that all micronutrients are getting added, but it's not reaching, or it's not delivering the purpose for which it is being given. And when you connect with people and understand what they want, we used our innovation to convert the same THR into different formats so that they could use it in all those kind of preparations which they are used to eating.
Right in front of records, I have to say, children and adolescent, 600 million, so 60 crores in India. And what you are saying is that you're reaching directly the public, I mean, people. So the three things that we need to do is the recipes which are there, the pediatricians are the one where the patient will come, parents will come, and they do not discuss nutrition. If I am able to give them a chart which is for 6 months to 2 years, and then 2 to 10 years, and 10 to 18 years, if we have these charts, recipes which you made 300, I promise that these recipes I will distribute free books. That is a commitment, and the acknowledgement is all yours that you have prepared the guidelines. Is that fair enough?
Thank you. Thank you.
There are 91 videos in 22 Indian languages. Already, यहाँ पे mother can say कि मेरा बच्चा 16 महीने का है और उसको non-veg dish क्या दूँ, और she may say इसको veg dish क्या खिलानी है. Just check health spoken tutorials IIT Bombay. Thank you.
Pediatrician can become nutrition counselors and help in the capacity building.
I think it is very important that we don't look at anemia only in schools, which is government schools, and we report on anemia for the nation. When many of our children, many of our girls are going to private schools, we are leaving them out. Maybe we do social marketing of IFA tablets for them. We don't dole it out free, but at least speak the same language and say that adolescents, whether in school, government school or private schools, need weekly IFA tablets. Thank you.
I think for the first time in many years, nutrition is being considered as an important part in the development of the country. No doubt about it. It should not be seen as a welfare measure. Number two, most important is that, so I think there should be cross conversation. The communication that you talked about has to happen not just between pediatricians and nutritionists, but there's a large chunk of nutrition is in all domains. It's in Ministry of Food Processing, it's in agriculture, it's in health, it's in women development, it is in school, where it is not there. So I think the cross conversations between all these is not happening. It is not about communicating nutrition to the people, but it is also about communication nutrition among the policymakers, and then see how each sector can contribute better to nutrition. Even something like, roads and transport may have direct impact on nutrition. But does the secretary leading it know what role he has to play in ensuring nutrition of the child?
Thank you so much, all the panelists, and thank you so much, Karan, Vaibhavi, K-Corp. Thanks for this opportunity. Thanks a lot. I hope the audience has enjoyed this very passionate conversation. Thank you so much.